Hi, I'm Dr. Jones from Zetland Medical Practice, and today we're going to talk about prostate cancer. The reason why we're talking about this is it's the most common male cancer, with 1 in 8 men getting it in their lifetime. The other issue is that we're not seeing the amount of men presenting that we would expect from these figures, suggesting that some people have symptoms of prostate cancer and are not coming forward. Your prostate is a gland that sits underneath the bladder. There's a tube running from your bladder to the outside world which also passes through the prostate. This is called the urethra. The prostate's main role is it produces fluids that go into semen. The main issue is when the prostate starts to grow. This can either be cancerous or non-cancerous. The non-cancerous growth is called benign prostatic hypertrophy, or BPH for short. Symptom-wise, it's all to do with your waterworks, so it could be an increased urge to have a wee, having to strain to wee, or a feeling that you're not completely empty after you've been for a wee. So who's at risk? Generally, we say people over the age of 50. This is reduced to 45 if you're from a black background. And if you have a family history of prostate cancer in either your father or your brother, you're also at an increased risk of prostate cancer. The test comprises of 2 parts, a blood test and an examination. The blood test is called prostatic specific antigen, or PSA. The problem with this test is that it has a lot of false positives. So this means that you have the test and it's raised, you go through the referral and all the investigations, and then it turns out you don't have cancer. Obviously we don't want you to have cancer, but you may not want to go through the potential of having a false positive. At the moment, about 75% of raised PSA tests, in the end, they do not have cancer. So one of the ways we reduce this false positive rate is by avoiding particular things close to the blood test. So one would be not to ejaculate for 48 hours before the blood test, to not have the blood test if you've had a recent water infection or any infection in that area, or any surgery to the area. And lastly, we may delay the examination until after the blood test so that we ourselves don't cause it to be raised. The rectal examination. So this is essentially a finger placed in the bottom in order to feel the prostate gland. It's because of where the prostate sits, this is the easiest way for us to examine it. And this allows us to feel if it's enlarged, if it feels smooth or lumpy or abnormal. You don't have to have this test because obviously it's an intimate examination. However, we would recommend it based on the fact that the PSA test alone is inaccurate. Worst case scenario, your PSA test is raised or you have an abnormal feeling prostate, then what will happen? So we would do a 2-week rule referral. This is an urgent 2-week referral to rule out cancer. This means that you will be seen in the hospital by the specialist within 2 weeks of us sending the referral. And it's likely that they would do further investigations, which may be an MRI scan or a prostate biopsy. Let's say that the PSA is normal and your prostate does not feel cancerous but might be enlarged. Then what would we do? Well, we could offer you some treatments to try and improve your symptoms. One example would be tamsulosin. So remember, if you are in one of these risk groups or you have any of these symptoms, then please contact us to speak to a GP. You may have been sent this video because you requested PSA testing. I hope now you've decided that even if you wish to have the testing, you will also book a GP appointment so that we can examine you and discuss treatment options. So remember, don't ignore it. Book a face-to-face appointment with your GP and help us help you to get it sorted.